about to enroll in Medicare and you're trying to decide whether to sign up for a Medicare Advantage plan or sign up for Original Medicare with a Medicare supplement plan or Medigap plan, as they're sometimes called. Well, here to talk with me about that is Dana Onspot from Sensible Money. Dana, welcome.
Thank you, Bob.
So this is a decision that many people face who are enrolling in Medicare for the first time. And in some cases, they might be already enrolled in Medicare and deciding whether to move between a Medigap and a Medicare Advantage plan. You've created a decision tree to help people decide which is best for them.
I don't know if I would quite call it a decision tree, but I like that concept. I really think people want to consult with someone where this is all they do. As a financial planner, this is not all we do. We do exclusively work with people transitioning into retirement, so it's a topic we deal with often. But we even work with experts in this field to help our clients make this decision. So if there's anything I can pass along to people, it's not a decision you make lightheartedly. This quote decision tree that we'll talk through is really understanding some of the key differences, but it can vary tremendously by where you're located. So while we can talk very generically, someone in your state that knows your plans is the person that you're going to want to really weigh out the pros and cons of what we call traditional Medicare versus the Advantage plan decision.
Yeah. So where to begin?
Well, probably at the top, which is, understand that Medicare has numerous parts. Part A is the part that's free as long as you worked, enough quarters in the U.S. to be covered. And then Part B and D are things you pay a premium for. So the Part D, think of D as standing for drug or prescription coverage. And then there's, those are all separate parts you have to enroll in separately, just to make it really confusing, right? Then there's the option that came about, can't remember now, has it been 10 years ago maybe, of something called an Advantage plan that wraps all of these parts into one plan. And so you don't have to worry about, am I enrolled in Part B and D and all of this? I just have this Medicare Advantage plan. And so that's the first thing to know. Now, if you're going to go the traditional Medicare route, you have to enroll in Part A, B, D, and usually you're going to want a Medigap, or what's sometimes referred to as a Medicare supplement policy that fills in the gaps in coverage that aren't covered by Part A, B, and D. So already sounds confusing, right?
It does.
It does. It's crazy. So the first thing to understand is think of traditional Medicare with supplement is a PPO. You have your choice of providers. So you could go anywhere. Doesn't have to be an in-network provider. Versus the Advantage plan is an HMO. It's an in-network provider. It will cost more if you see someone that is out of network, or you may want a service or something that is denied. And so that may not be covered. Whereas if you were under a traditional Medicare with a supplement plan, that same service may be covered. So no, there's differences there in how the provider network works. Under the traditional Medicare option, you have complete choice. Under the Advantage plan, it's an in-network provider option. So you really want to make sure the people you want to see are in your network.
I was going to ask about cost. Oftentimes people are choosing plans based on costs. How does that factor in?
So, and it makes sense. We're retired. You want to be very budget conscious. The Advantage plans are often marketed as zero premium. Zero premium does not mean zero cost. I'll give you an example of a client who got breast cancer. So she enrolled in an Advantage plan. They were on a pretty tight budget, got diagnosed with breast cancer a few years later, ended up having to pay substantially more out of pocket on that Advantage plan for many years in a row while she went through treatment. She had a full recovery, so that was outstanding. Mm-hmm. But it cost a lot more than if she had chosen the traditional Medicare with a Medigap option. And so she realized that, and we talked about it. She's like, she was so healthy when she enrolled in the Advantage plan. So it was like, zero or really low premium seemed like the way to go. And even when you factor in the premium she would have had to pay under the Medigap, traditional Medicare with a supplement option, she still paid far more because of this advantage. So zero premium doesn't mean free. I looked up some rough numbers. If you look at the maximum annual out of pocket, these were 2023 numbers. Kaiser Foundation said that you might expect to have about 8,300 if you max out of pockets. You have a scenario where you have some significant healthcare events. This is under the Advantage plan option. And if you had to include out-of-network providers, your max out-of-pocket might be $12,450 under the Advantage plan. I ran some of my own numbers. If you instead had traditional Medicare with a Medigap policy, and those, including the premiums, your max out-of-pocket would come in, probably about $1,000 to $2,000 less over here. So, and that's just rough averages, right? Depending on your plan, your area, the exact situation that happens, you could have far more out-of-pocket costs under that Advantage plan. And so it's just something to be careful. Like, you're going to pay less. That's great as long as you're healthy. But if an event comes along, it could end up costing you more.
Yeah, I've run those numbers too, Dana, and sometimes I say you pay whatever, maybe $170 out of pocket, 170 or so odd dollars for Part B, maybe $200 a month for a Medigap policy. So you look at 370, maybe some odd dollars for Part D, and it comes out to roughly what, $400 maybe a month, and maybe you're healthy, and you're, maybe it's a matter of, pay me now or pay me later, right? Because you're paying $400 for something you may not need, but you may need it at some point if you do get breast cancer, because then the out of pocket is $8,000 per annum.
Yeah, and maybe the thing to do is, if you're in an Advantage plan and you're not paying any premiums, realize, well, let me set aside that money I would be paying in premiums in, a reserve bucket is that I will use for out-of-pocket costs should a healthcare event come along. And so that could be a way to kind of, great, if I'm healthy, I save some money, but I've been setting aside money for that particular situation if it happens.
Yeah, sounds prudent. In terms of Medicare Advantage versus Medigap, when people have designs on traveling overseas in retirement, any thoughts about that?
Yeah, so I was looking actually at all the Medicare plans, and you can go to Medicare.gov and they will have a comparison of all the plans. And so there's several plans that will cover up to 80% of the cost of a foreign travel emergency. Now, foreign travel emergencies can be pretty expensive, so you might still have that 20% cost that you have to bear. So that's if you choose traditional Medicare and you were to choose a Medigap or supplement plan that had that option, which is a good reason if you plan on doing foreign travel to say, I want to make sure I have one of those Medigap plans that will cover up to 80% of a foreign travel emergency event. Under the Advantage plan, I don't know, right? The plans are all different. You're going to have to study and see what may be covered. The other situation that we see under the Advantage plans is, because there's a limited network of providers here, there could be certain key cancer centers that aren't included in your network of providers, certain academic medical centers that aren't included in your network of providers. If you're a snowbird, I'm in Arizona at this time of year. It's November when we're filming this. The snowbirds start coming in from all over the country, a lot from the Midwest. And so if you're a snowbird, well, and you occur an event here while you're in Arizona, but your home base is in Minnesota or Illinois or Wisconsin, you could have out-of-network care providers, and it could be quite expensive under that Advantage plan. So one of the considerations is, how much travel will you be doing, both out of the country and across the country, if you plan on being in multiple locations, or maybe you're just going to go around the country staying in Airbnbs or RVs or whatever that may be. In those cases, having a choice of any provider could be actually less expensive over the long run.
So I'm fond of saying that I never want to live more than 10 miles away from Mass General Hospital because I want the quality of care. Is that a factor that people need to think about in your decision tree?
I mean, location is a factor in terms of the Advantage plans themselves. And so you will see, again, if you're very healthy, the Advantage plan is going to save you money. There was some interesting research I saw that said, the quality of care, if you have significant events such as cancer or surgery, might be less under the Advantage plan. And so specific study I read said that Medicare Advantage enrollees were less likely to have been treated at a top rated cancer center or hospital than those that were under the traditional Medicare option. Another study said that Medicare Advantage plan enrollees were less likely to have been treated at a high volume hospital. And so volume, particularly when it comes to surgery, the study said is associated with the quality of care. And so that's kind of a roundabout way of answering your question. But, if you are near a high volume hospital or a, very well-known, acclaimed cancer treatment center, are those places included under your in-network providers on an Advantage plan? That could be something to think about. And the reason that's so important is you could be completely healthy, you enroll in an Advantage plan, and then you get cancer or you need a surgery. Well, now you can't just switch back even during open enrollment to a Medicare supplement, traditional Medicare option. You have to go through underwriting. So your first 6 months when you're eligible for Medicare, you can choose any plan, no underwriting required. But once that 6-month window is passed, right, if you want to flip back to the traditional Medicare with a Medigap policy, now you can be required to go through underwriting and you may not qualify. So you may be, stuck over here under that Advantage limited network set of providers. And now you're going to have to pay more to see the providers that perhaps you want for your situation.
Yeah. So in the case where someone wants to go from Medicare Advantage to a Medigap, they go through underwriting and they find that they could, one, like you said, get denied coverage, which means they're stuck in their Medicare Advantage plan. Or if they are accepted, they may have to pay a higher premium than they might have otherwise had they enrolled early on.
Correct. Yes, they may be at a higher premium now. Correct.
Yeah. So it's sort of like a decision that you really have to think long and hard about at the very beginning of enrolling in Medicare versus sort of like 10 years into retirement, let's say.
Yeah. And if you're well off and you have the means, our tendency is to say, go the traditional Medicare plan, pay the premiums, and now your worst case scenario. We've capped off the worst case costs in a high risk scenario. And yeah, if you stay healthy your whole life, it may cost you more, right? But it's a risk management choice at that point. Right. You've said I've done a better job under traditional Medicare with a Medigap policy of managing all the potential costs and risks that could come along. Over here under the Advantage plan option, I am still retaining some of that risk, which makes sense, right? It costs less. So there's always a trade-off that's going to be there.
Yeah. Right now we're in the middle of open enrollment, and folks, 60 million folks are looking at their Medicare plans. And in some cases, they're looking at their Medicare Advantage plans. They're receiving notices that their Medicare Advantage plan is being terminated. What choices, options do they have in their decision tree?
Yeah, so exact situation I encountered in a conversation with a client yesterday. They had just enrolled in their Medicare Advantage plan, and then it was got a notice a month later that it was being terminated. So if there's another Medicare Advantage plan in your area, you will have the right to join that. If you're losing your Medicare Advantage plan because it's leaving the program, or Medicare hasn't renewed their contract, you will have a guaranteed issue right to buy a Medicare supplement plan if you return to the traditional Medicare option. And so that could be worth considering at that point because you won't have the underwriting requirements. What do you do? The other situation we're seeing is that providers are stop accepting your Advantage plan, right? And so that can be a more challenging situation. So your Advantage plan is still in place, but you go to the provider you went to 6 months ago or a year ago, and they're like, no, we don't take your Advantage plan anymore. And now you're going to be paying your out-of-pocket network fees. Then you have to wait when open enrollment comes. You can decide, do I want to go back to traditional Medicare, but you might have to go through underwriting, or is there a different Advantage plan in my area that I could switch over to?
Yeah. I know we've covered a lot of ground. There's some things that I know we missed. What are they?
In general, when people who leave Medicare Advantage plans are doing so because, they're finding the out-of-pocket costs can vary a lot. The network restrictions might be frustrating. Having to get prior authorizations for care can be frustrating. And so they might find it can be difficult to use the benefits. And so if you want that freedom of choosing your providers, again, you're going to pay premiums, but the traditional Medicare with the supplement plan is probably going to be the way to go for that complete freedom of choice.
Yeah. I'm fond of quoting some research done by Sudipto Banerjee, who sometimes tries to put in perspective what healthcare costs will be in retirement. We've seen studies, you've seen studies that suggest it could be that you would need $400,000 set aside at 65 to pay for 30 years of healthcare costs for couples to pay for 30 years of healthcare costs in retirement. Can you put that in perspective for us as we sort of wrap up here?
Yeah, so I believe he did several studies for T. Rowe Price that are downloadable on healthcare costs, and you sent those over to me. I read them all. I thought they were very interesting. One of the most interesting things was they said that while most retirees have a great fear of a big healthcare financial shock, the actual percentage of them that experience it is relatively small. And so and not just experience it like many people might experience a year with a higher healthcare cost. We've all had that, retired or not, right? But very few experience it in a prolonged state, right? Where it's year after year of higher healthcare costs. But there is still that percentage, and that can happen. It's just reassuring to know it's not as common, even though it is a big fear of ours. And I think part of that fear is simply it's the unknown, right? It's one of those things we can't really control other than doing our best to stay healthy, living a healthy lifestyle that can help. But the actual percentage of retirees who experience a catastrophic cost isn't all that high.
Yeah. Dana, as always, I want to thank you for sharing your knowledge and wisdom with us. It's so greatly appreciated. And thank you for putting in perspective how to go about choosing what to choose.
It's not an easy decision. As we always say, you definitely want to do your homework.